What would be the 3 to 4 takeaways you would give somebody for a brand team?
I think some things don't change. Number one thing that doesn't change is unmet medical need doesn't change. So look for the unmet medical need. And what we wanted was to stamp quality. That if Germany means quality, we are ready to make our raw materials in Germany, bring them here and sell it to the Indian patients or give it to the Indian patients.
So when did Janssen happen then?
Janssen happened, that was my last MNC stint. That happened in 2013 and I decided to come back to India. Johnson & Johnson offered me the opportunity to lead their pharmaceutical business in India.
How did you manage this milestone by milestone growth of this company?
See, there are two ways to do it. One is to make a big bold statement and make people run over it.
Yeah, we all do that.
Yeah. Second way is to not allow that pressure to seep in, but let pressure seep in on what is your final goal and attempt. Minister for Health used to, and Chemicals and Manufacturing and Health used to call every Thursday 4 p.m. roughly around 4 to 5 p.m. He used to call every week
Wow.
just to follow up. Is everything okay? Do you need help?
Hello once again and welcome to Pills in a Pod, a podcast where we feature healthcare leaders, game changers and change makers. This small little pill that we started is now getting bigger and bolder. And today we have none other than Sanjeev Navangul.
Thank you so much for inviting me, Alim. I think I have heard and listened to your show. It's an honor to be on your show. Thank you.
I always tell people, besides my mother-in-law, I wonder who watches the show. But thank you so much. It helps me anyway. Sanjeev, we're going to start like how we always start. Before we delve into the professional part of your life, and there's so much to talk about. There's Janssen, there's MSD, there's Januvia, there's Bharat Serum, there's Mankind. There's so much to talk about. I want to know you as a child. I want to know what you were, where were you born, who were your parents, and what was your upbringing like?
So look, in that terms, I am a complete recluse village boy. Yeah, because my father used to work for a public sector company called HOC, which is about 60 kilometers away from here. And we were staying in a colony which was jungles, colony, river, and our facilities. So that kind of place I grew up in. So I grew up within nature. I think we had all the facilities, but obviously schools had just started there. So the whole teaching and all was still new there. So my teachers, basically my biggest teacher was curiosity at that time.
How beautiful.
We had a fantastic library and we had great environment. And we had many stalwarts coming there and talking to us every weekend or so. So great atmosphere culturally. So education was more about these things. And that's where I was until my schooling ended. And my college, I went to Baroda to do my pharmacy. And I did my MBA at Symbiosis. So that was my education. And yeah, clearly after that, my life is only pharma industry, nothing else.
But why pharma?
It's a little odd. It's an elaborate story, but to tell you very frankly that after my schooling, I could have done many other things. But I ran away to Baroda to meet my uncle and I used to love the city.
Oh, I thought girlfriend.
Not so lucky. So it just happened that there was an entrance exam going on and I gave that exam. I got through engineering and pharmacy. Decided why not do pharmacy without understanding what it meant at that time. But sometimes decisions pan out the way they pan out. And today I feel very satisfied that as somebody said to me in my early life that do something meaningful in life. So clearly I found it more rewarding than selling soaps.
I think a lot of people take that dig. Interesting. And then you joined one of the largest and most beautiful company, Janssen. Is that one of your first companies you joined?
No. Actually, I started at a company called Hext, which doesn't exist anymore as a name. I was there for 16 years.
Oh.
So Hext became Hext Marion Russell, then became Aventis, and today is known as Sanofi.
Right.
So I was there for a very long time. In fact, it gave me a lot of opportunity to work across, you can imagine everything. I started in APIs, then did financial controlling, then was in international business, did supply chain, sales and marketing. So all kinds of stuff I could do there in that company. And not only here, but I worked that time in India, in Russia, in Germany, in Philippines. So it gave me a lot of exposure.
Wow.
So it was a great 16 years there. I think when it became Sanofi, I actually stepped out, and that is because the opportunity was knocking.
Correct. So when did Janssen happen then?
Janssen happened, that was my last MNC stint.
Okay.
That happened in 2013.
Mm-hmm.
I was leading MSD in Philippines at that time, and I decided to come back to India. And Johnson & Johnson offered me the opportunity to lead their pharmaceutical business in India. And that's how 2013 I came back to India. So I was there from 2013 to end of 2019.
Since you mentioned MSD, let's talk about what you did at MSD. And the whole world knows what you did. It was Januvia. So if one had to understand your game plan and take 3 or 4 takeaways in terms of what brand teams can learn from Januvia, because that's a case study of sorts.
It's interesting you mention a case study because I don't know how many people know this, but IMS had a global magazine where they celebrated global successes. And one of the case studies that they wrote about was Januvia in India.
Wow.
So it was quite an achievement for us in those times. But so to come back, I think when MSD was getting formed, one of the things that we decided, and my colleague Dr. Swashresha is here. He was the medical director there also. So what we decided was, let us not build a company like any other MNC in India. Let's make it meaningful enough for this country to identify with the company. And if you go to the Merck headquarters in White House Station at that time, there is a way, as soon as you enter, there are 2 things that confront you. Number one is there is this old man holding a stick and a young boy dragging the stick for the old man.
Okay.
Now, this is about a disease in river blindness in Africa for which Merck still produces the medicine ivermectin and donates it free of charge to that country. So it just shows the commitment to illnesses and patients in the world.
Ivermectin was this deworming thing, right? Yeah.
So
Okay.
what George Merck said, we just put over places there. It says that medicine is for people. And if you understood this, profits follow.
Lovely.
It was also on the Time cover of 1950, I think. So when you join that company, you start realizing true meaning of what you should mean to society.
Correct.
And that's where MSD got constructed. So it was not only about Januvia, but about vaccines we launched, about the other products we launched. It was all about how do we make it more meaningful for society. Now, when we launched Januvia, the challenges were different. India had just signed TRIPS and become TRIPS, let's say, compatible at 2005. So when we were going to bring in Januvia, we were going to be the first company in India to launch a patented retail product in India.
Wow.
So we carried responsibility, risk and reward.
Yeah.
Literally 3 R's we were carrying at the same time.
Lovely.
As we were carrying that, I think the most significant aspect of it was preparation.
Yeah.
And I told my team that you start preparing, we will only launch the product when we are ready, and not take a backward calculation on a launch date and say this is the day we are going to launch it. And readiness was defined in many terms. So it's fairly elaborate, including, I'll give you one elaborate thing, is stakeholders. So we decided who are the stakeholders for this. We decided the Prime Minister of India is a stakeholder.
Wow.
We said patients are stakeholders, doctors are stakeholders, the people involved in policy making are stakeholders, the patent lawyers are stakeholders, the society is stakeholders, general public is stakeholders. So how do we engage with everybody? There has to be a plan for everyone.
Yes.
And I can tell you that our chairman came down to India and met the Prime Minister of India.
Wow.
to ensure that we are talking the same language on trips.
Yeah.
Yeah, so it was to that extent that preparation was done solidly. Second thing was important was how to prepare in market research. I think how do you understand what kind of positioning a product should have and what change it will bring in treatment pattern. The biggest challenge at that time was the fact that we found out was that doctors generally keep HbA1c target a little higher because the risk of hypoglycemia is higher in our patients, and there is acute times when patients go to doctors and don't go regularly for checkups. So if that is the case, how do we avoid it? So what does the drug do? There's no risk of hypoglycemia. So that was something that allowed fearless treatment. Second thing we realized was this was changing treatment paradigm completely. It was allowing the pancreas to rest. So there are many medical advantages that we saw which were coming, and this was therefore we did treat it as a launch of a product, but treat it as a change in treatment protocols of this country on diabetes.
Correct.
And therefore we decided to launch our product in that method. So there was no big launch meeting, no fanfare, nothing of that sort happened. It was small doctor meetings everywhere explaining why we are doing so, what is it that makes it relevant, and we kept all our stakeholders informed. So if I had to go to the health ministry and talk about it, I had to go to commerce ministry and talk, I used to do it because everybody should be aware that what we are trying to do is the right thing. So this is a big lesson that when you're doing something important, do it and plan it properly. So on April 1st week, 4th of April, I think it was in 2008 when we launched the product, it was, the whole company was consumed by it.
Yeah.
The entire company was consumed by
And the
it.
whole industry was watching.
And whole industry was watching. Many for good reasons, many for whatever reasons. But people were watching.
Yes.
And we had no reason to fail.
Yeah.
We took even the pricing to a different level. In fact, it was pitched at $1 a day to the global team when average pricing in US was $5. So 1/5 of the price of US. So it was, we called it responsible pricing, and it has caught on. Now everybody gives interviews and talks about responsible pricing, but it was coined in my office at that time. so it was interesting to hear, how the feedback on some of these things later on. But that plan worked. And sustainably, how to manage patients, because that was another point we saw, was the fact that we created a call center in Hyderabad much ahead of its time, where there were 52 nutritionists. We are talking about masters in nutrition.
Wow.
People. 8 languages. People sitting there, being given free consultation to patients who enroll on the program based on doctor's prescription, and linking their diagnostic, their doctor treatment, and the call center data together longitudinally. So doctors could access their patient data to understand that how their patients are getting managed. And we did work there to find out that whoever was on the program did far better than people who were not on the program.
Yeah.
So it was so far ahead of the times. Today I hear there is one company in the US who launched a similar program with a valuation of $19 billion.
Ooh.
So those ideas stuck, and India therefore gained recognition in global Merck setup. At MSD, what happened was MSD India became the idea generating or ideation center sometimes on many things then. So Januvia was landmark for us, but did many more things to many careers than just the product alone.
True. If you have Januvia on your resume, it's a big thing today. But if in today's age, what would be the 3 to 4 takeaways you would give somebody for a brand team?
I think some things don't change. Number one thing that doesn't change is unmet medical need doesn't change. So look for the unmet medical need. Second thing that doesn't change is you don't launch a product. You prepare for launching something that will make a difference and understand that fully. And third is, unless it is going to be meaningful for society, your brand will make no impact. So if I have to do that again, I would consider these 3 things again.
Interesting.
And every other launch that I did which became successful, I was very conscious of these 3 things.
Very interesting. I think there's a lot to take away. And then after Januvia, Sanjeev, you go to Janssen. Was that a difficult movement? What happened at Janssen that really defined your time and memory over there?
I think that the changeover was not so difficult.
Hmm.
Merck and Johnson were similar companies in terms of culture, way of working. I would only say that Merck, the amount of science that used to get discussed in every meeting was higher than Johnson and Johnson. While in Johnson and Johnson, people, management, philosophy, leadership got a little more weightage in discussion.
Hmm.
So it's about slight cultural differences, though I think patients came first for everybody. When I joined Janssen, there was one significant thing happening globally at Janssen. One was that many more new products were coming in and markets were supposed to launch them. So on one hand, I had to prepare how do we launch all the new pipeline of Janssen. And we ended up doing that successfully.
Yeah.
And whatever trials were required, whatever was required for Indian regulations, we did everything properly and literally put a line together for launches. Second thing that was happening there was that after 40 years, there was a new drug coming to treat multi-drug resistant tuberculosis. And for some reason, I took it on myself that if there is one disease in India that needs better treatment, it is tuberculosis.
Yes.
I don't know how much people realize, but the amount of deaths tuberculosis does in India is very high.
True.
Every year it is substantial number. And doesn't get treated. And a multi-drug resistant patient in a year can infect 10 more people.
Yes.
So imagine if 50 such people are roaming around in the Mumbai local. Mumbai is in a way dubiously TB capital of the world. Yeah, just Deonar will have more patients than India, rest of India. So that's the kind of disease prevalence that we have. And it's a sad thing. And not much was happening. Globally, no research was happening.
Hmm.
So when this drug came about, I created a team. Along with the team, we used to literally go and hammer in Delhi every day that let us do something about this. RNTCP, which is the Revised National Tuberculosis Program, was something which they used to see our face every day. And sometimes I think they started thinking us as furniture of the office. Yeah. So to that extent, it became crucial. And 2014 we started having meetings. 2015 was a significant meeting held. It was somewhere mid of May. It was hot outside, and Dr. Vinod Paul of Niti Aayog actually supported the fact that we were doing something for TB. The DGHS then held a meeting in mid of May and literally confronted everybody that today patients are dying and we are keeping on discussing what should we do with this drug.
Correct.
Why can't we approve it quickly?
Yes.
And then he got a protocol done. And by the way, the protocol was done by Dr. Soumya Swaminathan, who afterwards became the principal scientist of WHO.
How lovely.
Yeah. So one of the biggest breakthrough for her was also this
Yes.
work on
Yes.
TV that she had done.
How nice.
So it helped us, it helped her, it helped India. I think it helped everybody. But the point was that I think that allowed approval of the drug early.
Hmm.
And we only released it in the government program because we wanted to control it to MDR TB only, because if it goes to private market it can get used everywhere. So rather than doing that, so it was, and we picked up 6 major centers. We did all the studies. Can you imagine that at that time, I don't want to put an exact number, but hundreds and millions of dollars worth of drug was offered free by Johnson & Johnson to Indian government.
Oh, wow. Why would they do that?
Because commitment to patients and trying to treat where the disease is. India had the highest burden of TB, and the company was seriously committed. And
In a non-profit way.
giving it free.
Yeah.
Yeah. And the pricing was brought down to a great extent for India. And we literally changed the guidelines. It has become today, if you see now, it is oral treatment. Injectables have gone out, toxic drugs have been removed from the protocol. So there is a huge change in the way TB gets treated in this country. This has happened like a silent revolution. And this work that I could contribute to would remain strongly with me from that J&J stint. I think the Janssen stint will be remembered for the tuberculosis work.
How lovely. How lovely. And then you leave all this behind and join an Indian company. What was going on in your mind?
Actually, when you start running companies for a long period of time, you start thinking what next. And these things have always confronted me. I'm not a person who likes to do things because it's a career step or want to grow up the ladder or want to run after chase something. It's not one of my passion. I want to always be doing something meaningful in life, and therefore I have remained understated. I do my work and go home. The reason that I made this shift was something very different. Reason. My thinking was that India, if you look at Indian pharmaceutical market, the core of the Indian pharmaceutical market is either great marketing or great manufacturing or both together.
Hmm.
This has been the strength of most or all the big
Yes.
Indian pharma companies.
Yes.
And they have built it into an art and really done well. But I always, being coming from MNC, always felt that India was down the value chain. Why can't at the core of an Indian company be R&D and innovation?
True.
And that led me to potential that BSV had. And that led me to this decision that unless I do it myself, it is wrong of me to make platitudinal statements in seminars
Yeah.
and go and lecture the government that they should do something is one thing, which I could do as much as many, and I have done it many times. But do it yourself is the most important lesson we learn in life. So I said, let me do it myself. Why am I telling others to do something? So primary driver of that was this. Secondary driver of this was the fact that professionals of my type joining P-led transformationing Indian companies was not very common.
Correct.
So I said, okay, this is another opportunity that how much can a professional deliver in a setting is something to be tested. And instead of telling others to test, let me test it myself.
Yeah.
So these two were the big drivers of me coming over to the Indian side and join BSV.
And now you're leading this, you led this P-led, mission and vision of yours. But you also say that I didn't throw the vision into people's faces. I've seen some of your interviews and you say, I didn't throw the vision. And you just led them to milestones. But in a world where we say 2030 vision, number one company in the world, how did you manage this milestone by milestone growth of this company?
See, there are two ways to do it. One is to make a big bold statement and make people run over it.
Yeah, we all do that.
Yeah. But that carries pressure. Yeah, that carries a different pressure. Second way is to not allow that pressure to seep in, but let pressure seep in on what is your final goal and attempt. In this case, the attempt was to create a new company, solid company, Indian company, which is based on R&D and innovation. If that was the goal, then we had to be focused on that goal. And for doing that, you have to build all the pieces around it. So creating goal over different pieces and joining them together was something in a way more attractive to me than trying to make a big bold statement. So it's like a jeweler, or somebody who creates something out of a stone, a nice statue out of a stone. Yeah. Now, when these things happen, then you have to do it hit by hit over a stone.
Yeah.
Or carving has to be very good, or you have to build yourself up over a longer period of time.
Yeah.
So Sachin Tendulkar was not created in a day.
Correct.
So you make a lot of effort towards it, or a musician is not created in a day.
Yeah.
I remember once Bhimsen Joshi telling me himself that what comes out of my throat, or in his language, जो गले में से आता है उसको पहले गले में उतारना पड़ता है. So it was a very nice way of telling what it is.
Yeah.
So if that is the case, then it was better to build that vision in a way that will be digestible to the people, and they work and focus on how the goal can be achieved, rather than putting them and what they call as big hairy goal.
Big audacious hairy goals.
Whatever.
That.
So I said I didn't want to do that. Yeah, because this became a much easier thing to digest, and controlling the overall creation was something which I could do because of experience. But having leaders for every goal was important. So if you really look at BSV's success, it was all about having good leaders in every place. Great leaders in every place did 90% of the trick. 10% was help required for them. So they made my job easier. I could sit here and give interviews like this, and they could do all the work. But it was fascinating, and I think we delivered. We seriously delivered on creating an R&D based company now. And look, today, if you ask the government, if you go outside, if you go to any other world, you'll realize that for R&D, BSV gets counted very, very strongly
Yes.
in the setup.
Yes.
They respect what the science that we bring in, and we are dealing with difficult science. We have always confronted difficult science, so it has worked well for us.
I'm going to talk to you about R&D in a while, but I wanted to ask you this on a personal level. How did you go home every night thinking that I have to make this 10-15,000 company and I can't tell anyone about it?
I think, look, P's are very straightforward people. Yeah, they say, look, in 5 years' time, we'll be gone. But these are the 3-4 things that we need. Now, that is P&L management, and that is ensuring that those financial goals are met. That is their base requirement. Yeah. So I told them a very simple thing. I said, look, I will take care of the financial goals, but don't get too involved in the way the company is being built, because that's my vision.
Correct.
This is your goal. This is my vision. So, and they were very nice about it. They allowed it. They were very, very nice, and generally P's are thought as very tough people, and all. These Advent people are very nice.
How nice.
So when I walked in here on 3rd December 2019, I was very clear in my mind that I had an opportunity to build a company on, I am the, say, maker of this company. But on the other hand, I have responsibility of financial goals. So when your purpose is bigger in life, then you can take the lighter weight of financial goals of companies in a much better way. If you make financial goals heavier than the purpose, then they will confront you.
Correct.
So when I went home, the only thing I was looking forward to was spending time with my wife and talking to my kids. That's all that I was worried about.
And then you're saying December 2019, and then within a month you get hit by a shock of COVID.
Yeah.
How did you deal with that?
Oh, that was an interesting period. I was hiring my team. So all my team joined, most of my team joined remotely.
Lovely.
Now, this must be quite a record that an entire leadership team is created virtually. But they were, by the time they came in and met each other, they were so friendly with each other because we used to do so many things together, talk to each other so often. We created a team spirit and bonding by which everybody felt very connected with each other.
Lovely.
So that was, I think, an interesting challenge. The second challenge was that COVID threw a new challenge at us because I think people only heard about vaccines at that time. But we were the principal manufacturer of many of the medicines that were key to COVID treatment.
Yeah.
Liposomal amphotericin B. I don't know how many people realize, but we were only the second company in the world besides Gilead who could manufacture it. And you had this black fungus story.
Yeah.
Only manufacturer. Imagine the pressure government put on you.
Yes.
There was a additional secretary who used to call me roughly about 10 times a day.
10 times a day?
Day and night, I must say, because he used to call me at 3 a.m. also.
Ooh. And if you didn't speak, he would escalate to Modi ji?
Frankly, we got opportunity to speak to everybody in the government.
Lovely.
Including the then Minister for Health. Used to, and Chemicals and Manufacturing and Health, used to call every Thursday 4 p.m. roughly around 4 to 5 p.m. He used to call every week.
Wow. Just
to follow up. Is everything okay? Do you need help? So the coordination between the company and the government was. So we were manufacturers of many crucial medicines. First 2 days we didn't know what to do. Third day government started asking us what is happening to manufacturing. So we had to keep everybody in. And imagine the challenges. At manufacturing setup, most of our workers come from nearby villages.
Correct.
Now the village sarpanch is telling them you cannot go to work.
Correct.
Government is telling us people have to work.
Yeah.
So at both we have to manage.
Yeah.
So our people actually went and requested the Sarpanch, told them what great service this company is doing to humanity in India, how we are saving lives. And many people started cooperating because of this kind of purpose. So the challenge then was dramatic for us. It was highly rewarding because you can imagine the amount of people's lives we saved during that time. And we are talking about 4 products which were necessary for treatment, where we were amongst the very few manufacturers across.
Wow.
So we were equally important as a vaccine company at that time.
True. True.
We didn't make too much noise of it, of course,
Yeah.
but I think if you ask me in hindsight, we were no less important than a Serum Institute or a Bharat Biotech at that time for the
Absolutely.
country. And imagine the pride people took. It was great that this happened in the beginning of this journey because employees took a lot of pride in where they work for
Absolutely.
and started to build a culture which was therefore out of pride that we do something good for society.
Yeah.
And imagine the pleasure you get when you do good for society.
True.
So, yes, COVID threw a lot of challenges. We had a lot of issues. But imagine that whenever there are challenges and issues, leaders' job is to find opportunity in it.
True. 100%.
And that's what our leaders did here. That they found opportunity in it to build around it a special company.
Sanjeev, now talking about that R&D which I told you that I'll come back to. As a company, BSV is a forward-thinking organization, right? I mean, you'll have these biopharmas, biologics, and all these things happening. And then you also have these made in Germany APIs. What excites you about all these pieces coming together?
So let me take the smaller question first about this made in Germany.
Yeah.
I don't know how many people know this, that we are the only company or the first company to do a first Indian company to have a greenfield operation in Germany
Wow.
across industries.
Can you explain the audience what greenfield means actually?
Means starting from scratch. There are Indian companies who have bought German companies and done business.
Yeah.
But here is a case of building manufacturing there from scratch. So that's greenfield.
Super.
When you buy a company, it is known as brownfield.
Oh, okay.
It is already existing.
I didn't know this
But this
brownfield
is-
one for sure.
So this is greenfield.
Lovely.
So I think we should take pride in it.
Absolutely.
And what we wanted was to stamp quality. That if Germany means quality, we are ready to make our raw materials in Germany, bring them here and sell it to the Indian patients or give it to the Indian patients. So to ensure that BSV stands for quality. So that was a great purpose that we had, and it could be a gateway to the Western world also. So that was about Germany. But what is special about biologics? Biologics innovation or biologics creation has democratized the medical world or pharmaceutical world. The chemistry based research became so expensive in the world and therefore got dominated by top 10, 12 companies in the world.
Yeah.
While biologics innovation is happening as startups everywhere over the
It's
world.
a level playing field for anybody.
It has level playing field, created level playing field for everybody. It might require lesser elements and lesser resources to start off, but the quality of scientific thinking that is required is high. And you're solving for, see, world changed in biologics in many ways. One was this democracy. Second big change that happened was we are moving away from treating and managing a disease to resolving a disease, arresting the disease or trying to recover from the disease or trying to eliminate the disease in the patient. So this is what biologics is doing. So this is a huge changeover for patients. So in that process, biologics revolution allows India to become part of the change in a much better way than the chemistry changeover. Indian companies can invest in biologics and get there in the global map. So if that is happening, creating a biologics based company was one of the better ideas for BSV.
Correct.
And BSV builds its R&D platform on those strengths. So for example, we have a recombinant platform. Now, there is a degree of difficulty in making recombinants. So MABs are considered to be basic
Yeah.
recombinants. But as you go up the ladder, making hormones recombinant is very high in the order. And making CAR-T or those kind of medicines is higher. So now we said we will make all fertility hormones recombinant. Now that's a huge step.
Yeah.
There are 4 big ones, 2 are made already here. Two are and cell lines are getting ready. So we are becoming the first company in the world to make all the fertility hormones recombinant. Now that's something special.
Yeah, yeah.
So
And coming
recombinant
from India, so,
coming
so
from
much
India.
of pride. Yeah, yeah.
Yeah, we have this innovation of ours, which is a global innovation called anti-D, which is a recombinant Rh negative immunoglobulin.
Yes.
Now, the world had everywhere a human derived or what you stimulate a male Rh negative person, grow the immunoglobulin, take out, and then you grow it in a culture, and then you make it into an immunoglobulin to be given to others, to patients, to Rh negative women during pregnancy. But this we developed a monoclonal one first, and now the recombinant one. We are the first in the world for both.
Wow.
So again, global innovation has happened in India, and what people do not know much about is the fact that this is India's global innovation, which has global patent. So, and we are now selling in many countries.
Wow.
So it's getting recognition. It has a INN name from WHO. It has been stamped with Prix Galien Award. So it just proves that it is a global innovation.
True. Super.
So the next one that we are doing is in, we have the perfected art of making antibodies, immunoglobulins, which are basically treating certain difficult diseases, such as snake bites.
Yeah.
Again, we are probably the biggest company in creating anti-snake bite venom. And we are going ahead and ahead with it. We are working with the government, with government institutions like IISc and everybody to create regional ASVs, regional anti-snake venoms. Because the regional snakes are different in India.
Right.
So how do you make it more customized for patients to better survival rates?
So people catch the snake and bring it to the doctor. Ye saap ne kaata type sa.
I'm sure this also happens,
Yeah.
So there are so many things, but still hardly anybody goes to the doctor.
Yeah.
That's where the biggest challenge is.
Really?
Yeah.
I mean, if a snake bites you, go to the doctor. What else do you do?
But not in so much in villages.
Yeah. Oh,
They will
okay.
try some treatment. They will have this jadu tona. So many other things happen in villages. Yeah.
Oh.
It's getting reduced,
Yeah,
but
yeah.
it's still there.
Yeah.
So how do you, and you reach in a particular time window, your chances of survival are higher.
Hmm.
But we are doing, so we make those. We make equine rabies vaccine. So if the wound is larger from a bite, animal bite, then you require one more immunoglobulin. And that gets manufactured by us. We are probably amongst very rare companies doing this. So we are going ahead and trying to see at a number of other diseases. There is malaria, there is dengue, there is so many other diseases. That can we create immunoglobulins, antibodies which can help us treat a patient in a more effective way if they have this disease. So that's another platform we have created in a stronger way. So these are difficult platforms to create, but we have managed to create them.
Oh,
And we are
nice.
doing a lot more work in many of the other things. So this, we are trying to see whether certain new areas we can enter with this. So like anti-infectives. And so there are a lot more activities we are doing in the company, which is creating a different kind of R&D, which will be acceptable to the world. And whatever we do here can become global innovation and not local innovation.
Lovely.
So that's the idea behind creating a strong R&D. It gives a lot of pride to everybody,
Yeah.
including the country.
Yeah.
Yeah. So
Including me sitting over here. I'm so happy.
so we should do this, and India should fight for being a big part of the global biologics revolution.
True. True. Sanju, you spoke about fertility, you spoke about hormones. So then let's touch about women health. And I know BSV historically has been a women health company. So what and how are you doing that makes sure that you're committed to this cause yet?
See, I think BSV now as a brand is now starting to get well known in India as well as many other countries as a women's health company,
Yes.
and which we take a lot of pride in.
It's 50% of the world.
Yes, it's 50% of the world, but let me also give you some shocking data. In India, every 1 out of 2 men can get treatment and goes to a doctor and ends up getting some kind of treatment. The ratio drops to 1/4 for women.
Yeah, that's so sad.
Yeah. And that is the sad part. So if we are championing women's health, we are also championing the fact that India's health improves because India improves women's health.
Absolutely.
So this is the big contribution that we can make to the country.
Yes.
And therefore being focused on women's health and the complications related to women's health is so important. And therefore we are starting to build a much wider portfolio to tackle women's health issues in such a way that we ensure that they get treated better and build programs by which this is treated with empathy, and lot of help is provided to ensure that these treatments are done properly. So it is not just our ability to make a product and bring it to the market, but what will define us is our commitment to women's health, because this is ensuring India's health.
Hmm.
And a healthy nation is a wealthy nation.
Correct.
From US we are learning a wealthy nation need not be a healthy nation. So
Correct.
So if that is the case, India needs to be healthy. And if India needs to be healthy, Indian women needs to be healthy. So that's the whole philosophy behind it. And in practical terms, we are building product after product after product to ensure that different women conditions which don't get treated properly in this country gets tackled well. And therefore, we take the community along, we take women along, we take the medical fraternity along to build programs around it then.
And what are the therapy areas you're focusing on?
See, so puberty to menopause is our area where we are mostly focused on.
Hmm.
So adolescence to menopause, and in that there are different women's diseases that you have. We talked about fertility, we talked about the Rh negative women with endometriosis, PCOS. There are several other diseases that confront women, and all those we are trying to work through the portfolio to ensure that we provide adequate treatment for this.
Now, Sanjeev, let's move to the other part of BSV, which is the vaccines part of it. Now, you talk about technology, you talk about equality, you talk about disease, but yet this country is still not up there when it comes to its vaccine consumption and, overall understanding. What do you think is lacking?
I think this question has to be divided into two parts. Part one is in pediatric vaccines, India's penetration is now very reasonably good.
Yes.
I think companies have done a great job in creating pediatric vaccines. The government has done a great job by creating this Indradhanush program.
Correct.
And now most of the pediatric vaccines that are required get locally manufactured. Penetration is at varying levels, but it has certainly crossed 70%. And when you cross 70%, then you create mass immunity in many diseases. So in a way, I think we are starting to get there in pediatric vaccines. Our bigger challenge now is going to come in adult vaccination. See, what India has not faced because of age demography is the fact we don't have an aging India which is that high, which we are now confronted with. It's starting to get an aging India population which is very high. So adult vaccination is going to become the cornerstone in future. That is where India is underprepared. And the penetration of vaccine in adult vaccination is very low. If I ask you, did you take your flu shot this year?
No.
You will say no. Yeah?
Did I get my flu year? This year, yes.
Yeah. So 99% of the people
Yeah.
say that. Imagine where we are lacking that. And we lose human mandate. We lose mandates at work.
Hmm.
We lose productive days. So how do we create that kind of adult? So that is where the challenge, adult vaccination is going to be the next big challenge, where probably it may not become so much serious in terms of government priority, in terms of providing for it, but government might help in terms of helping promotion of it. Yeah, insurance companies might help. So all of us, if disease burden goes down, insurance companies are benefited. Their claim ratio reduces. So therefore, I think they can be a good partner. Doctors can be a good partner. Community can be a good partner. But adult vaccination is the way forward. And that is where I think India's work is now left unfinished.
Sanjeev, a lot of people talk about the culture of BSV, but I'm also intrigued by the strategy. So they say, that culture eats strategy for breakfast, but you managed to make this lovely avocado toast and, build this whole thing together. What is the secret sauce of BSV's culture? Why do people talk so much about it?
If we finish everything at breakfast, we'll have no lunch and dinner. No? so to create that lunch and dinner, you need to marry strategy with culture.
Lovely, yes.
I think we try and make culture the way of living in a company. And culture is all about how people treat each other, how they believe in each other, how they trust each other, how they work together. And that is irrespective of strategy. So I'm not a guy who wants to mix these two things up in terms of creating. These two mix together well and create a special company.
Hmm.
So we need to understand that, you know, we always say that we have EQ and IQ. Strategy is about IQ
Hmm.
and culture is about EQ.
Right.
But we always want a balance between EQ and IQ.
Correct.
So why should there not be a balance between strategy and culture?
Absolutely.
So culture building here was about how we wanted dignity in the company, treatment in the company to others, everybody else, trust in each other and working together for a bigger cause. As a leader, your job is not to offer jobs. People come to work because they have a job, but people perform because they have a cause.
Right.
So creating that purpose and cause is leader's responsibility. And that purpose and cause comes through strategy. Now, converting that strategy into an emotional connect with employees is where culture plays a big part. Because people don't respond only to strategy, people respond to the emotion behind the strategy.
Correct. Correct.
So, leaders' responsibility is finding that good bridge of emotion between strategy and culture. And that is where I have focused all my career on. That you can think of 10 good ideas and they all might be great. But if you want to get them implemented, it has to mean something to your people. And your employees need to own it in terms of how they feel about it. So that is where strategy and culture gets managed. And then they feed each other. So what we are seeing now at BSV is that strategy is feeding into culture and culture is feeding into strategy. And that's such a nice blend. If there is one thing that I never want this company to lose, is this fantastic blend between strategy and culture. And how to convert ideas into emotion and ownership. This we should never allow to break. That's why for a leader this is an extremely important thing. And therefore I have never been fascinated by this strategy its culture at breakfast story, because it diminishes one.
Hmm.
And diminishing any one thing is not something that we would like to do. You want to become good, you can be good without diminishing anybody else. It's like, in cricket we'll always compare Sachin Tendulkar with somebody else and then say, well, why? It's okay, enjoy everybody.
Yeah.
Yeah, I enjoy Rohit Sharma's batting, I enjoy Sachin Tendulkar's batting, I enjoy Don Bradman's batting. It's okay. It's happy to enjoy. I've all my last 20 years I enjoyed Federer, Djokovic and Sinner. Federer, Djokovic and Nadal. I was at Wimbledon a few days ago and I really enjoyed what Sinner and Alcaraz were doing.
Oh, I can't believe you actually went for that match.
So it's fun.
Yeah.
It's fun. So enjoy all good things. Make something good out of it. And therefore strategy and culture are hand in hand for me.
And then Sanjeev, you're saying that you don't want this company to lose its core. But with the Mankind deal happening now, how will you ensure what is going to be your next step?
So look, first of all, I think this was a very, very good deal for everybody. And I'll tell you why. It was a very, very good deal for Advent because they got their return out of it.
Yeah.
It was a very good deal for employees because employees got rewarded because of this deal. I think so. Recognition. I think the company got a lot of recognition
Yes.
because of the deal. So it was good for me. And look, for Mankind, it was entering super specialty.
Hmm.
So which also was good for Mankind.
Yes.
And if the core of this company remains innovation, I think this can remain the innovation arm of the company. And this can contribute significantly to the future of Mankind as a company because of its innovation ability. So there is a special place for BSV within Mankind. And I think the Mankind management or the owners are very, very sensitive to the fact that they want to protect the core of this company in a way that the innovation story continues in a strong way. So they are very committed to this story.
Correct.
The other advantage is innovation requires long-term commitment. And Ps want to buy companies and sell them for within a particular time period because they have their fund length.
Yeah.
Selling or transferring this company from PE to a strategic or a regular organization has great benefit for BSV. because it allows continuity in innovation now for a longer period of time. I don't have to think for 5 years.
Correct.
I can think, oh, 10 years later we'll do this, 15 years later we'll do this. This is easily possible due to this. So the benefit is substantial for everybody involved in this. So you have to look at this in terms of what is changing globally in terms of healthcare, what could be sustainable companies for the future, and therefore why is the BSV element of it relevant for future.
Correct.
And that is where we should go, and that is where we are going right now. Yeah, so it's a step forward for everybody to now focus on ensuring that innovation continues.
So I'll just take one step back. How did this Mankind deal happen in the first place? And what are the challenges you faced? And what should one keep in mind when such kind of handshakes are happening?
So a pretty interesting experience. I have been on the side of big MNCs which they were buying companies, and so it was a different thing. Yeah, there we spent more time on diligence than actual process. I think the diligence was a big part of it, and I can't tell you how tiring it used to be, but and I can't even talk about the deals that I got involved in at that time. But clearly, it was different way. Here, we had to be the face of the deal. Ultimately, what was being sold was the company. So company and its leadership became the focus.
Yes.
So the entire work that has been done in the last 4 or 5 years had to be explained to every potential buyer continuously. We had to prepare, rehearse, build our story. We do a lot of homework had to be done. At the same time, we had to demonstrate that there is great future life in this company, but also be truthful about what we are. Because we have to sell a product, not a packaging. Otherwise, you might have a nice packaging and a bad product.
डब्बा खुलने के बाद क्या हो गया
So,
अंदर?
who buys, it will leave a bad taste in that person's mouth. We have our credibility at stake. Yeah, our personal credibility also at stake. So, we had to be real. So, the challenge was to maintain how real you can be and how to show the future of this company. So, this was the big challenge that we had. And it's very draining. I can tell you the 6 to 8 months of process was very draining because all the potential buyers used to morning to evening to night 24 hours ask us questions and keep on asking them. They used to repeat the questions. So you have to be very patient with everyone. And you have to go through everything and you have to think about every major potential buyer as the final buyer. Therefore, you have to put in the same energy with everybody. So that was pretty draining
exhausting,
for us.
yeah.
And not part of a job which we were experienced with. We didn't know all this. This was completely new to us. This is something which we had never done in our life. So it was not easy. We started, I think, the process somewhere, I think 22nd, 23rd of April or something, we announced the process. If I'm not mistaken, 25th June or something, we signed the deal. Mankind clearly came out as more real and hungry buyers for this deal. They were very quick. Very quick. So imagine in 3 months' time we were done with the signing, and in another 3 months' time we were done with the entire closure. So it was a very, very quick deal for everybody. And the Mankind management actually showed a lot of courage in trying to close the process quickly. And the Advent management was more than willing to cooperate in that. So I think our role nearly stopped around June after the signing, because I think we were done. We had to get back to our normal jobs. And then it was between Advent and Mankind.
The easier part of the life.
But those 8-9 months of preparation and those 3 months were particularly draining. We learned something new. We learned new skills. We learned how to conduct yourself in a circus. It was not easy. And we also got experience of how private equity look at a company, how regular companies look at the same company, what is the difference between them, how they ask questions differently. So big learning for us. I think the outcome was good for everybody, and that was the underlying theme, that let's make this outcome good for everybody. Let it not be a win-loss for anybody. Let it be a win-win for everybody. So if you ask me, the biggest success of this deal was win-win for everybody. More than the financial outcome, which was tremendous. But I think the win-win deal was probably the better story out of it.
Sanjay, I'm not going to drain you more because I know you're reminiscing about that the tough time that you had. But I still want to ask you 2 or 3 easier questions. So, HUL is known as the CEO of Factory, and then there's Sanjeev, who's known as the CEO of Factory himself. You built so many CEOs in this industry. Tell me, what do you remember about people that you have kind of, mentored, and what are the pieces of advice you get? Can we get some free advice like that also?
I think you know what, one of the benefits of my career was the fact that very senior leaders in the company very early on put trust in me and gave me difficult responsibilities, thinking, oh, this is a mess, let this guy do it. So I learned, and my experience came about by the trust shown by senior leaders in me when I was young, and honing my talent to establish myself in my career and giving difficult assignments. So I said to myself that one day when I become senior, one of my responsibilities is to trust talent and give them opportunity
Yeah.
and help them through success. There are company goals, there are organizational goals, all that can be met. But we need to see individual goals and how they can be met, and never allow talent to go waste. So my biggest work happened in trying to hire good talent and give them assignments, difficult assignments, train them and make them something out of them. And that groomed them. And giving early exposure, giving difficult assignments meant that they learnt a lot. And I used to hire talent on personal credibility sometimes. And just confronting straight away in an interview or when I used to meet people. I had in MSD, I had this famous saying that trespassers will be recruited. And I'll give you an example of that.
Yeah.
I remember Shweta Rai. She came in from IMS to make a presentation to us. I think she was product executive or something. She just joined there and I think a year old or something. She made a presentation and I realized this girl has a lot of talent. So after the presentation, I called HR and said, make an offer to her. She has to join here. She joined the company at that time. Then she was with us in MSD. She was with us in J&J. Today she is managing director of Bayer. Yeah. I remember another guy, and I'll stop at these two, Sanjay Sharma. Sanjay, again, highly talented, came in, I think, in MSD as in the strategy office as a young guy to work. And when I came back to India and joined Johnson & Johnson, I actually called him and hired him as my EA, saying that, Sanjay, come here. Sanjay was more than willing to come because somewhere he had developed a soft corner for me. He came in and, but he had to be trained in different ways. So first he did strategy, which he worked well. Then I sent him to business. He had to work hard in trying to build one of the most difficult businesses. We knew he's not going to do great in making that a big success or something, but we knew he would learn a lot in that. Then when we realized that he is doing okay, then we realized he has cultural sensitivity to build. So we sent him to Japan, which was probably the most difficult place to insert yourself. He learned cultural assimilation in Japan. Today he is now running BMS in India. So these are high talents. They are much better people than me. I think many of the people who are CEOs now and have far more talent than me.
You're being humble.
Sorry?
You're being humble.
No, recognizing that people are good, ensuring that you help them through their initial phase, making them supporting them because they make themselves. Ultimately, if you ask me, I can take credit for mentoring them for whatever little while, but they have become where they are because of their own ability. Yeah, and I think we should give full credit to them for them. So helping such talent across the industry has been a passion for me. Even today, a lot of people from other companies keep talking to me, send me messages. If they can't find me, they send me on LinkedIn a message saying that, can you help me? Will you mentor me? That kind of stuff. And I don't understand this mentor definition, frankly. I can only understand how to create a helping hand for people to bring the best out of them. I don't want to make it complicated. I don't want to write a book on mentorship or something and give 10 principles of mentor. But most important is understanding talent. And talent has its own ways of surfacing. Talent has its means of expression. Sensitizing your ability to understand how that can be done, channelizing their energy properly, ensuring they get difficult opportunities to learn from, and don't expect success out of every opportunity you give them. Expect successful learning out of them. And I used to measure potential and not performance for them. So you pay for performance, promote for potential.
Nice.
That's where talent comes in. Look at their potential and promote them the way you should. And speak about them openly. It's okay. Praise the talent. It's good to do that.
Lovely.
Nothing wrong about it. We criticize so openly, very quickly.
Yeah.
Why can't we praise quickly?
True.
It helps people.
Yeah.
Everybody likes
reliable.
positive strokes.
Absolutely.
So that's the way to build talent. And I think I've been lucky. I've been lucky that great talent worked around me, and therefore they have achieved wherever they have reached. So I am very happy. One of the biggest pleasures as I finish my career would be to build so much of talent in the industry.
True. And Sanjeev, for my last question is, when you raise your glass to celebrate all your milestones, what are the 3 or 5 milestones you'll really remember and say, yes, this was it?
I think, if you look at company-wise, I mentioned that at, I think, Hext, it was more about difficult assignments thrown at me and creating credibility. At MSD, it was all about how to create a company and do a product launch. At Janssen, it was about public health. And here it is about R&D. And last one, 5th one, is about building talent. So these are the 5 things that I think I will remember in my career. But there is a 6th thing that I will remember in my career. And that probably is equally dear to me, which will carry on after I end my working career also, is the fact that I think 6th and 7th, I would say. 7th, I would say something is very personal, but 6th one important to me is that passion for excellence drove me to understand different fields and understand personalities, meet successful people and understand why they are successful in any place, in anything, whether it is sports, music, social life, anything. It was good to meet those people and understand, because if you look in organization, 100% is success. What is success for a singer? A good song, but he or she can do better, and do better and do better. Yeah. Was there end to what Lata Mangeshkar could do? No. Was there anything that Sachin Tendulkar could say that, okay, I am the best? No. He would say, I can learn more, and he still says that.
Yeah.
So the point is, excellence in sports and music or these kind of fields has no limit. So passion for excellence is something which I cultivated in terms of thinking, and therefore it has led me to friendships with very different kind of people. So my social life has nothing to do with industry. I leave industry when I leave office, and most of my friends are from different fields. They have
Nice.
nothing to do with this industry. So that's the 6th one that I will remember and will continue to be part of my life. And 7th one is my family. I think I'm very much attached to my family. My wife left a career for me to succeed, saying that if both of us are passionate about careers, it is not going to work. So let one take a step back, and she sacrificed for that, which is something which I will always pay for. I think. Second is, I think both my daughters, I think they get a lot of love from me, and I get a lot of love from them. Both are doing okay, I think. So I'm happy about them, and they've come out well. They have not troubled us. So it's important part of my life. So 6 and 7 will remain with me.
Lovely. Of course.
5 time will forget, but 6 and 7 nobody can forget.
Sanjeev, I'm very tempted. I'm trying to end this podcast, but I can't, because I just want to derive as much as I can. I want to ask you, for leaders, and even I run my own organization, what would be 4 or 5 messages you'd leave for us who aspire to be greater?
See, I think, there are many definitions of leadership. and I don't want to focus on definition of leadership, but I always say that leadership is about your true self, and it is about you, what you are. The more genuine you are, the more true you are, the better leader you are. Don't try to be somebody else. Leadership is also about style. So you should have your own style of leadership. I think I remember Veeru Sehwag once telling that the day he realized that he should not copy Sachin Tendulkar but become Virender Sehwag, he became Virender Sehwag.
Correct.
Yeah?
Yeah.
So now that's what it is, that you have to understand that you have to develop your own style. As you go higher and higher in leadership, you have to mean less and less to yourself but mean more and more to people around you. And understand and take that responsibility on yourself, that you mean a lot to many other people. I get out of my room, and if I misbehave with someone here once, the entire office will keep speaking about it for a week. Because that is the level of scrutiny that a leader goes through. That doesn't mean he or she has to be more conscious, but that means he or she should know how to conduct themselves properly and do the right thing all the time. Leadership also means that morals and ethics have to play a much larger part of your life than anything else, because you need to stand for something. You cannot be changing your opinion on things based on circumstances. You have to be true to what you are thinking. Leadership also means that you have the ability to confront, that you should be able to defend your position, confront others, argue about what you feel is right, and also have the ability to leave the table. Power of leaving the table is one of the biggest powers a leader can have, and that just shows the stickiness to principles. So the last I would say about leadership is that it is your responsibility for people to understand your strategy, cause, purpose, everything that you stand for. It is your responsibility to keep talking to people, explain to them. And if you are not able to communicate what you want to do, you will never be able to do anything. That communication is an art. Also, one flexibility a leadership should teach everybody is that each person is built differently. Like, I am a seriously complete introvert. So if I am with people, I have to be alone for some time just to get back my energy. But leadership means you have to be within people. So I had to build extra muscle, put extra energy. It takes a lot out of me. But I had to build that style. I had to learn that. So ability to learn new things is important for a leader. Circumstantial leadership is important. Situational leadership is important. But what you stand for cannot change.
Correct.
So I don't know whether there is an exact definition, and each one should define leadership for themselves. But understand, leadership is a huge responsibility, and we have to take it seriously enough to become a leader. That's probably the most important thing.
Sanjeev, I thank you from the bottom of my heart for all the time that you shared, all the gold that you shared with me. It is far more precious than anything anyone can own. I thank you for coming on Pills in a Pod. I think our audience is going to learn a lot from it. And thank you for inspiring.
Thank you, Alim. I think now I know why your program does well, and I can only wish you all the best. I think you're one of the most, what can I say, most genuine hosts that I've come across on a...
I'll take that compliment.
And I wish you all the best.
Thank you, sir.
Thank you.
And I thank you for watching Pills in a Pod. I learned so much. I'm sure you did too. And share it with someone who you think will find this useful, because everyone should hear what Sanjeev had to say today. Thank you.